Malnutrition is a serious health condition. It happens when the body doesn't get the right amount of nutrients. This can mean not enough nutrients or too many. There are different types of malnutrition. Undernutrition occurs when a person doesn't consume enough calories, protein, and essential vitamins and minerals. This can lead to wasting, being too thin for one's height, and stunting, being too short for one's age. Overnutrition, on the other hand, is characterized by excessive intake of calories, often from unhealthy fats, sugars, and processed foods. This can result in obesity, increasing the risk of chronic diseases such as heart disease and type 2 diabetes. Micronutrient deficiencies occur when the body lacks specific vitamins and minerals, even if calorie intake is sufficient. Examples include iron deficiency anemia, vitamin A deficiency leading to vision problems, and iodine deficiency, which can affect thyroid function. Malnutrition can lead to many serious health problems. These problems can affect children and adults. Here are some examples. Marasmus is a severe form of malnutrition that occurs due to a severe deficiency of both calories and protein. Children with marasmus have a severely emaciated appearance with very little body fat. Kwashiorkor is another form of severe malnutrition, primarily caused by inadequate protein intake. It's characterized by edema, particularly in the feet and abdomen, as well as changes in skin and hair color. Type 2 diabetes is a chronic condition linked to overnutrition, particularly excessive sugar intake. It disrupts how the body regulates blood sugar levels, leading to various health complications. Malnutrition is a complex issue with many contributing factors. These factors can be socioeconomic, health-related, cultural, or age-related. Poverty is a major contributor to malnutrition as it limits access to nutritious food. Limited access to education and healthcare can also contribute to malnutrition. Certain health conditions, such as digestive disorders or chronic infections, can interfere with nutrient absorption or increase the body's nutritional needs, leading to malnutrition. Cultural practices, such as food taboos or restrictive diets, can also limit the variety of foods consumed, potentially leading to deficiencies. Additionally, infants, young children, and the elderly are particularly vulnerable to malnutrition due to their specific nutritional needs and potential difficulties in accessing or consuming food. Malnutrition has devastating consequences for individuals and communities. It affects physical health, cognitive development, and has significant economic implications. Physically, malnutrition weakens the immune system, making individuals more susceptible to infections. It also impairs growth and development, leading to stunting, wasting, and other health problems. The cognitive impact of malnutrition, particularly in early childhood, can be severe and long-lasting. It can lead to impaired brain development, affecting learning abilities, memory, and overall cognitive function. Economically, malnutrition reduces productivity, increases healthcare costs, and hinders economic growth. It traps individuals, families, and communities in a cycle of poverty and poor health. Section 5. Combating malnutrition, prevention, and treatment strategies. Addressing malnutrition requires a multi-pronged approach that includes both prevention and treatment strategies. These strategies aim to improve nutritional intake, address underlying causes, and provide medical care when needed. Nutritional education plays a crucial role in preventing malnutrition by empowering individuals and communities to make healthy food choices. This includes promoting breastfeeding, balanced diets, and safe food handling practices. Supplementation programs provide essential vitamins and minerals to populations at risk of deficiencies. This can include iron supplements for pregnant women, vitamin A supplements for children, and iodized salt to prevent iodine deficiency disorders. Food assistance programs offer a safety net for food-insecure individuals and families, ensuring access to nutritious food. This can include food banks, school meal programs, and other initiatives. Healthcare integration is essential for identifying and managing malnutrition, particularly in healthcare settings. This includes regular growth monitoring for children, nutritional assessments for at-risk individuals, and timely referrals for treatment. Section 6. Global efforts in the fight against malnutrition. Recognizing the global burden of malnutrition, numerous international organizations are working tirelessly to combat this critical issue. These organizations focus on research, advocacy, and implementing programs to address malnutrition in its various forms. The World Health Organization, or WHO, plays a leading role in setting global nutrition targets, developing guidelines for nutritional interventions, and supporting countries in implementing these programs. They provide technical assistance, monitor global nutrition trends, and advocate for policies that promote healthy diets and nutrition security. UNICEF, the United Nations Children's Fund, focuses on improving the nutritional status of children, particularly in low-income countries. They work to promote breastfeeding, prevent and treat severe acute malnutrition, and address micronutrient deficiencies in children. Section 7. Recognizing the signs of malnutrition. Identifying malnutrition early is crucial for effective intervention. Knowing the signs and symptoms of different types of malnutrition can help individuals seek timely medical attention and prevent further complications. Undernutrition often manifests as weight loss, fatigue, and muscle wasting. Children may exhibit stunted growth, delayed development, and increased susceptibility to infections. Overnutrition, particularly obesity, is characterized by excessive weight gain, increased body mass index or BMI, and abdominal fat accumulation. It can also manifest as fatigue, shortness of breath, and difficulty with physical activity. Micronutrient deficiencies often have specific symptoms depending on the deficient nutrient. For instance, iron deficiency can lead to fatigue, pale skin, and shortness of breath, while vitamin A deficiency can cause night blindness and dry skin. Section 8. Diagnosing malnutrition, a multifaceted approach. Diagnosing malnutrition involves a comprehensive assessment that goes beyond simply looking at weight and height. It requires a combination of clinical assessments, anthropometric measurements, laboratory tests, and dietary assessments to determine the type and severity of malnutrition. Clinical assessments involve a physical examination, reviewing medical history, and evaluating symptoms. Healthcare providers look for signs like weight loss, muscle wasting, edema, and specific deficiency symptoms. Anthropometric measurements involve taking precise measurements of height, weight, body mass index, and body composition. These measurements help determine if an individual is underweight, overweight, or obese, and track their growth over time. Laboratory tests can identify specific nutrient deficiencies by analyzing blood, urine, or other bodily fluids. These tests can reveal deficiencies in iron, vitamin A, iodine, and other essential nutrients. Dietary assessments involve evaluating an individual's food intake patterns, including the types and quantities of food consumed. This helps identify dietary imbalances and deficiencies that may contribute to malnutrition. Section 9. Treating malnutrition, a path to recovery. Treating malnutrition requires a tailored approach depending on the type, severity, and underlying causes. Treatment options may include nutritional interventions, medical management, and supportive care to address both the physical and underlying contributing factors. Nutritional interventions focus on providing the necessary nutrients to correct deficiencies and restore nutritional status. This may involve dietary modifications such as increasing calorie and protein intake, and the use of oral nutritional supplements or, in severe cases, enteral feeding or parenteral nutrition. Medical management addresses any underlying medical conditions contributing to malnutrition. This may include treating infections, managing chronic diseases, and addressing digestive issues that interfere with nutrient absorption. Supportive care plays a crucial role in malnutrition treatment, particularly in severe cases. This may involve providing emotional support, addressing psychosocial factors, and ensuring a safe and supportive environment for recovery. Preventing malnutrition, building a healthier future. Preventing malnutrition is crucial for public health and breaking the cycle of poverty. It requires policy changes, community interventions, and individual empowerment. Promoting exclusive breastfeeding for the first 6 months is essential. Improving access to nutritious food prevents malnutrition. Social safety net programs and school meals are vital. Local food production and reducing waste are key. Access to clean water and sanitation prevents infections. Promoting hand washing and proper sanitation is essential. Empowering women through education improves household nutrition. Section 11, the road ahead, continued efforts and collaboration. Addressing malnutrition requires ongoing efforts, collaboration, and sustainable solutions. This includes research, policy advocacy, and community-based interventions. Regular monitoring is crucial for tracking progress and tailoring interventions. Conducting surveys and tracking food security indicators is essential. Policy development creates an enabling environment for good nutrition. Policies should support breastfeeding, healthy diets, and access to nutritious food. Collaboration among all sectors is essential for sustainable solutions.